Bismillah ar-Rahman ar-Rahim. Anatomical basis for endoscopic sinonasal surgery. I am Dr. Muhammad Zaki Hilal, Professor of Ear, Nose and Throat at Shams University, Cairo, Egypt. Prerequisites for safe and effective endoscopic sinus surgery and skull-based surgery. It needs meticulous knowledge of the anatomy, and by anatomy we mean imaging anatomy and endoscopic anatomy, special attention for the middle turbinate and the uncinate process, and also for the skull base orientation. Secondly, knowledge the pathology of the lesion we are dealing with, whether bony, soft tissue, benign, malignant, vascular. All these will determine the techniques we handle such lesions. We start with the anatomy. Sinonasal anatomy is complex, and one of the complex structures is the middle turbinate. The best description is that it has different parts. It has two ends, the anterior end and the posterior end, free edge, two laminae, lamina recurvata or vertical lamella connecting the middle turbinate to the skull base, starting just below the frontal sinus and then getting attachment to the cribriform plate. The basal lamella is connecting the middle turbinate with the lateral wall of the sinonasal tract. Here is the endoscopic view of the septum, middle turbinate, and the uncinate. The anterior attachment of both of uncinate process and middle turbinate here at the axilla of the middle turbinate. Above it is the agar nazi area, and just anterior to this area is the surface marking for nasolacrimal sac with the shining suture between the ascending process of maxilla and the lacrimal bone. The middle turbinate is fixed by pillars, so these pillars are very important for the stability of the middle turbinate, and during endoscopic sinus surgery, preserving these pillars will give us a stout, strong middle turbinate at the end of surgery, and this will avoid the meatal stenosis, because a flabby middle turbinate may retract laterally and block the outlet of the anterior group of sinuses. We start anteriorly for the lateral attachment. The anterior attachment of the middle turbinate is at the axilla. Here is the axilla of the middle turbinate with the anterior attachment combined with the uncinate process. Just anterior to this is the agar nazi area, and actually this is the anterior wall of the frontal recess. The second lamella, which is very important, is the basal lamella. Here is the middle turbinate, here is the maxillary hiatus, and here is the lamina papyracea. And the best description for the ground lamella is that it is composed of three portions. The first one is here, and this first one is oriented in the coronal plane vertically, and then it goes backward and inferiorly. This is the oblique part, and here is the horizontal part, or the third part. So this is the first part oriented in coronal plane, second part is the oblique, and the third part is the horizontal, ending at the posterior end of the middle turbinate here. A fresh cadaver showing the middle turbinate, and here is the lamina papyracea, and this is the parts of the basal lamella, starting here with the first part vertical, second part oblique, third part horizontal. This is the posterior boundary of, or the anterior ethmoid. If we want to go to the posterior ethmoid, we have to fenestrate this basal lamella as in traditional FESS technique. Just few millimeters above the junction between the oblique part here and the horizontal part. So this area is the area for fenestration of the basal lamella. The fovea ethmoidalis and cribriform plate. The fovea ethmoidalis, or the roof of the ethmoid, is actually part of the frontal bone. Here is the frontal sinus, first fovea, lamina papyracea, and cribriform plate. In right side, this is a closer view, and here is the anterior ethmoidal artery coming from the lamina papyracea from the orbit, traversing the roof of the anterior ethmoid and gaining entrance intracranially at the vertical lamella of the cribriform plate. Here is the superior attachment of the middle turbinate to the cribriform plate. This is the horizontal plate of the cribriform plate, while this is the vertical or lateral lamella of the cribriform plate, and here is the middle turbinate going inferiorly and at right angle goes posteriorly alongside the attachment to the cribriform plate. Here is the expected first part of the basal lamella or ground lamella, and here is the point of entrance of the anterior ethmoidal artery, which is the weakest point of the skull base. Uncinate process attachment. Here is a graph from booklets of Storz, and Husman make this diagram with the uncinate process like that. I took this uncinate process and projected it on a cadaver like that, magnifying the view, and we are going to see the attachment of the uncinate process. This is the bulla ethmoidalis, and here is the hiatus similionalis. The anterior attachment of the uncinate is to the ethmoidal crest of the ascending process of maxilla, followed by a wider area at the posterior border of the lacrimal bone. Then this is the inferior attachment to the ethmoidal process of the inferior turbinate. At this point, the uncinate has no bony attachment. It is only enclosed in two layers of mucosa. One of them is nasal, the inner one is infundibular. So one can rock or do palutman to the uncinate to delineate its attachment anteriorly. Posteriorly, the uncinate sends finger-like projections to the perpendicular plate of the palatine bone in the posterior part of the maxillary sinus. If we draw a line between these two stars, then the area anterior to this line is called anterior fontanelle, and the area posterior to this line is the posterior fontanelle, and both fontanelles can have accessory maxillary ostia, and this ostia will help ventilation but will never help mucus drainage, because mucus drainage is coming from the natural ostium by the mucociliary mechanism. Superiorly, the uncinate has a complex insertion, and this superior attachment of the uncinate is crucial for the drainage of the frontal sinus, and we are going to discuss this in details later.